Great.
Oh, this is live on Facebook.
I think we've made it, Matt. We're here.
Yay! For everyone who is just now tuning in, we just had the best interview. It was hilarious, very informative. And then we realized we weren't actually broadcasting. So from the top.
It's quite tragic. Take two.
Take two.
So Matt has promised to say exactly what he said for the past 10 minutes. Just kidding, no pressure.
I'm almost 40 now. I don't remember that well.
So let's back up. My name is Renee, and I'm the Community Engagement Coordinator with the Memorial Foundation, and you are tuning in to our Friday Health Tips series. And today we're coming to you from our homes, live on Zoom. And today's program is about Veterans Advocacy. And Matt is the Veterans Advocacy Program Manager at Yakima Valley Memorial. It's a new position. I don't want to steal his thunder, so I'm going to let him tell you about that. But let me tell you a little bit about the Health Tips series first. So we do this every Friday, and it's just a fun way where we can bring you tips around movement, mindfulness, purpose, belonging, nutrition. And this series is sponsored by Yakima Federal Savings and Loan. We're really grateful for their partnership, and we'll post some more information about them and our links and Matt's links in the comments when we're finished. So feel free to share your comments and your thoughts and your questions. And if we don't get to them in this live stream, we will be sure to answer you in the comments when we're done. So enough of the formalities. Matt, would you tell us a little bit about yourself and what you do here at Memorial?
Sure. So I am the Veteran Advocacy Program Manager, and that's kind of long, but very simply what we do is we try to make sure that we ensure healthcare equity and efficiency for our veteran population, and that we reach out in community health to see what we can do for the community. So equity and efficiency in healthcare just means that we try to do the best we can for different people groups. And we do this for a number of different people groups throughout the hospital and then the healthcare system, the outlying clinics. So for veterans specifically, I was a chaplain for the last 3 years at the hospital. And we noticed that there were a number of issues related to veteran healthcare that I kind of took on as a chaplain initially, and then in this position to see if we could do better by veterans. And just a short version of that is we were seeing that there were some excess length of stays for veterans based on administrative things. It's an odd thing to be part of two healthcare systems, and many veterans are patients in the VA healthcare system, and then also patients in a civilian healthcare system. And so there's a lot of communication that has to go back and forth that can delay getting out of the hospital. And there's a lot of really important medical things that happen too. If you think about it, you can be prescribed heart medication by a VA doctor and then also by a civilian doctor. And unless the civilian doctor knows or someone mentions that you also are part of the VA healthcare system, they may not know to reconcile those medication lists. So what we found is there was a myriad of ways that we could do a lot better in healthcare equity and efficiency for veterans in our healthcare system. And we have great clinicians, great pharmacists that knew that that's what they were supposed to do if they were dealing with a veteran patient, but a lot of times just didn't know. So increasing that awareness, and then also going for systematic change within our systems. So asking at registration, we just started a year ago for the first time, asking, have you ever served in the armed forces of the United States, all the way through making sure that we document that in a place that we can see, and doing some veteran specific training for our staff in the hospital. So everything that we can do to kind of make sure that we're doing the best we can for different people groups, and in this case, veterans.
Yeah, that's great. So you've been in this position for a year, and I'm guessing that already in that time you've seen a big improvement with these new systems and processes.
There have been a ton of improvements, and not as many as I'd like. So I think I'm thankful for the putting up with me that goes on with all of our systems techs and information systems managers and everything. So I want to push and get everything done now. But yeah, there have been a lot of improvements, and there are some more to come for sure.
Yeah. Well, let's jump into our tips now. I know that you've kind of prepared a few talking points for us to share. And then at the end, maybe we could share a little bit with how people can connect with you and where else you're connected in the community if they have more interest in these veterans programs.
Yeah, absolutely. Remind me about that, because we can talk about VA Advisory Board and Yakima Valley Veteran Coalition and all that stuff. So when I talk to veterans about accessing, this is the community health side. I'm talking to veterans who come into the hospital and I encourage them to access their medical benefits to the VA. I hear two objections predominantly. The first is I don't need VA medical care. It doesn't have much bearing on my life. And the second is it's really not worth the time and hassle. Have you ever tried to do that? And the quick short answer to that is yes, I am a VA medical care patient. I'm part of that system, and I know that there are some things, and it is getting better. So objection one, I don't need VA medical care. I hear people say I have good insurance. There's other men and women who have served that need those benefits more than I do. I'm not going to go and see if I qualify for VA medical care. I'll just leave it to them. And I have three responses to that, three things that you need to know. First, thank you. One, thank you for caring about other veterans, enough to forego what you've been promised and earned, because it is a selfless thing, but I think it's an out of place selfless thing. Two, VA medical care might be more beneficial than you think. Documentation of an issue, a medical issue you have that's progressing is important. Even if you don't have any serious medical issues right now, a yearly checkup is a good idea for all of us, regardless of our age or medical condition. Like we were talking about, I'm going to be 40 soon. I hear things that work so well after 40. We'll see.
That's right.
The point is, a yearly checkup also documents any decline in health. And even if you have no service-related medical issues now, your service can and will exacerbate issues or cause them down the road. And that being documented between here and there just helps the VA be able to provide the care that the government has promised for people who serve our country. So it's important to get, if all you're doing is going for a yearly checkup, it's still a really good idea. And response number three to that first objection, accessing your benefits doesn't hinder other veterans in Yakima, it helps them. There's a community-based outpatient clinic, a CBOC, that's up on Fruitvale right next to the Social Security building. That's the one clinic we have in Yakima for veterans. And the number of physicians and support staff they get, as well as the money they get for facilities and equipment, is based on the number of people being treated in Yakima. So even if you're only going in for a yearly checkup, you're actually helping other veterans. And there's no cap on what the government, there's no like limit where they say, well, we help veterans through December, but if we run out of money, there's just no VA care till January. That's not the case. So you're not taking money away from other veterans, and it actually helps Yakima to go in and be part of that medical system.
What a great point. That's something that I think hardly any of us would think of. When you use your services, you're helping other people because that's being documented.
Right, it's being documented. So it's super important. You're not taken away. You're actually contributing. And so then the other major objection I get is I could use VA medical care. I do have medical issues that probably were exacerbated by military service. Not worth the time and hassle, Matthew. And to that, I would say this. I understand that people don't want to spend all day on a 30-minute visit going to Seattle or Walla Walla. That's super reasonable. And if you want to go to Seattle or Walla Walla because you like the quality or the type of care that's being provided, that's awesome. There are shuttles from here to there provided by the VA. If you don't, though, June 6th of 2019 was the Mission Act was passed, and it really was about improving and redoing the focus of the VA on community care. So what happens is you have a primary care provider through the VA system that refers care, and then that referred care doesn't have to be a VA provider. I mean, personally, I've gotten referrals in the last couple of years for chiropractor things and a sleep apnea thing, and they've been fantastic about it. I talked to my VA primary care provider at the clinic. They were super awesome. They sent out a referral, and the VA paid for that community care. So you can get really high quality specialty care here in Yakima as long as that referral comes from your VA provider. And your yearly checkup is a great time to talk about those issues. So those are the first two tips. And my third tip would be, we made a cheat sheet because I like cheat sheets. Everyone does.
We love cheat sheets.
If you go to yakimamemorial.org/veteran, there's a video and a whole bunch of links, telephone numbers. I did all the research on like who's actually picking up their phones, and I put those ones on, and that will help people in accessing their DD-214, which is your certificate of discharge from active duty service. which you need to access your other healthcare benefits. There's links to the eligibility team in Walla Walla that can tell you how much you qualify for, if you'll have copays, if you won't have copays, that sort of thing, so you can make an informed decision. There's information on how to get community care referrals. And then there's also information about some Yakima area services we have. Like there is a counseling center that a lot of people don't know about for combat veterans related to that combat experience. It's right next to Gymnastics Plus on Lincoln. It's the Vet Center, and we have VSOs in Yakima and in SELA, Veteran Service Officers, that help people apply for benefits. So some of those contact information and phone numbers we have up on that site too. So there's links to forms that you need, and basically, if you don't want to go out and do the research of getting started with the VA process, it's really not that painful anymore. I know it's not as painful as it used to be. We've got a lot of those links for folks. So that's
awesome. And I mean, basically what you've said is you've just collected all of these community resources and put them on this memorial page, and we'll be sure to link that in the comments. And I mean, folks who are veterans and are looking for those services can use that link, but also their family members who might be doing some of that work for them and looking for some of that information can read through and help too.
Yeah, absolutely. And the VA is really good about that. There are some veterans who aren't able to call those numbers. And yeah, if you're next of kin, the VA will talk to you.
Wonderful. That's great.
Yeah.
And that's a new link on the website, right? That's something that you specifically put together recently in the past year.
It's one of the many shenanigans I've been up to in the last year. So thanks to all the staff for helping out with that too.
Awesome. We love shenanigans.
Yes.
That's great. Okay. So what is there anything, if there was one thing that you would want people to take away from these tips today, what would be that one thing?
I think the one thing would be do it sooner rather than later. It is very easy for us, especially, in times of COVID and times of so many things that are happening, to say to ourselves, well, like that's a back burner issue, but it would be a good idea and I'll get around to it eventually. Yeah. And I think when it comes to a lot of medical things, I am happy to leave them on the back burner until it becomes an emergency, which is not the best thing to do. And just like I said before, particularly when it comes to the VA, when we go in and go into a recruiting station, they say, if you get hurt in your military service, serving your country, we'll take care of you. We'll take care of that thing for as long as it takes. Mm-hmm. And a lot of people don't access that care because they don't reach out, or in some bad cases, let's be honest, the VA maybe might deny some claims that should have been approved. And I think it's important for us to honor some VA people, especially local people who really, really are trying to do their best, and some, VA people at higher levels really trying to do their best, and we should help them out. And we can help them out by starting today and going down and seeing what we're eligible for and getting those things documented with that yearly health checkup. That way, when it comes time to ask for the help that you need, the VA is able to do what they need to do. That would be the one thing.
That's great. That's great.
I hope that was as funny as informative as like the first time we went through it. It was longer, so maybe
it was. I think so. Yeah, I think this is a winner. Mm-hmm. Right. Plus, we're actually live now, so
nice. Oh, let me say one other thing.
Yeah.
This isn't the one thing, but you said to remind at the end of the deal.
That's
so yeah. just a shout out. There's a Yakima VA Advisory Council, and this is a group of folks who give advice and feedback to the VA to help improve the VA system. If you have any questions about VA Advisory Council, or you have some feedback for the VA, or you need help, please feel free to shoot me an email. I'm MatthewMcCay at yvmh.org. You can shoot me an email anytime. There's no period between the first and last name. Like all the military emails, there's a period. So for all the military folks, there's no period. I don't know why. And the other thing is there's Yakima Valley Veterans Coalition, and they're the group that's really active in helping vets out with whatever they happen to need to get them through emergencies. And they also run the stand down once a year in the fall at the Sundome. It's going to be at the Sundome this coming year. So those are two groups. If you would like to be involved, help out your fellow veterans, look into those two groups, because we can use all the help, and there are plenty of Yakima Valley vets that could use the help. So
great.
It's a great thing to look into if you're interested.
That is great. And we'll make sure to put those names and links and your email in the comments so everybody can access it easily after this.
Awesome.
Yeah. I want to read a few comments before we jump off, but Matt, I want to say thank you so much for your service and
Of course.
for all that you have done for the country and also for Memorial. I think this is so exciting, this program that you're spearheading.
Thank you. Thank you.
Yeah. Yeah. And thank you to all of our veterans out there in Yakima. We're so grateful. And we have some of those same sentiments on the comments. So glad you're there to support our veterans, and some thumbs up and waves and joyful arms and high fives and smiles. So we definitely have some good engagement out there on Facebook land, and we're really glad that you all have joined us. So anything else from your corner of the world?
No, just please get in touch if you have any questions or there's things that we can help you with. Don't hesitate to let us know.
Great. Same here. And thank you so much for joining us. The Memorial Foundation is so grateful for all of our community support. And we will be back next week in our Health Tips series. And we'll be featuring a recorded show from our Youth Works Council. And so be sure to stay tuned for that. Thanks, Matt.
Yep. Okay. Thank you. Bye, everybody.
Bye.